My name is Jennifer Chang, and I will be presenting the mechanism of injury, abrasion. What is an abrasion? An abrasion is an open wound that is caused by the rubbing of skin on a rough surface. Abrasions can range from mild to severe and can be painful. The mechanism of injury for an abrasion: granular and keratinized cells from the underlying dermis are removed superficially, usually by contact and friction of exposed skin with something in the immediate environment. Changes that will happen to the skin. Abrasions can irregularly denude epidermis and expose upper dermis with possible punctate bleeding and tissue exudate depending on the degree of abrasion. In first-degree abrasions, superficial damage to the epidermis will happen, and this is also called a scrape or a graze. In second-degree abrasions, there will be damage to the epidermis as well as the dermis, and there can be possible bleeding from this. In third-degree abrasions, which are more severe, there is friction and tearing in the skin tissue deeper than the dermis, and it's also known as an avulsion wound. And avulsions can bleed heavily and may require more intense medical care. So abrasions are really common. We see them a lot in sports, particularly in sports where a sliding injury can occur. So the first sports I think of are soccer and football, especially on a surface like artificial turf. There are a couple interventions that can be implemented to reduce the severity of abrasion injuries on these surfaces. And that can be with the use of protective equipment, skin lubricant, or even like a wet surface condition, maybe like spraying the turf with some water, or maybe if it had rained. And all these things can produce a positive effect on preventing abrasion type injuries or preventing more severe injuries from sliding against turf. So, some chronic changes to the skin that can occur from abrasions. Larger and deeper abrasions can also cause scarring. And the most important thing to look out for in abrasions is infection. Proper treatment and cleaning of the wound will help decrease the risk of infection. If there's any development of an infection, symptoms can include increased pain, warmth, redness, swelling, a fever, or discharge from the abrasion. So how you would manage an abrasion and how you would treat it. It is important to care for the wound with clean washed hands, rinsing of the wound without harshly scrubbing will allow the dirt and particles to be washed out while also preventing further damage from like aggressively scrubbing. So you don't want to do that. After cleaning the wound, application of an antibiotic ointment or petroleum jelly will keep the wound moist and help prevent infection. After the application of an ointment, the area should be covered with gauze and tape or a bandage in order to keep the wound closed and to prevent further bacteria from entering the wound. Changing the dressing or the bandage daily is ideal. And then with removing the old dressing, If there's some resistance because a scab has developed, it shouldn't be removed with like force. It should be actually soaked with salt water so that the bandage can like release itself from the skin. Scabs should not be picked at because, well, scabs are the body's natural protection against dirt and bacteria. And the development of scabs also mean that new skin is growing underneath. Furthermore, if you were to peel at a scab, it could open up the skin again, and it could possibly pull off more skin, and can cause a deeper wound, can cause bleeding, and a slower healing time. These are my references. I had two references. One was from Healthline, and another was an article that I found.